So many people think that testosterone is a man's hormone because of marketing. There are always going to be commercials about low T and men's clinics and a lot of male vitality. But what many people don't realize is that testosterone is actually the dominant female hormone. My name is Dr. Gina Haeussner. I'm the owner and medical director of Ageless Expressions. Women make more testosterone than either estrogen or progesterone in our bodies when we're cycling normally. Testosterone is made not only by a woman's ovaries, but also by the adrenal glands. So this is why over the course of menopause, her testosterone will naturally decline by up to 75%. So it's important to determine that delta on a routine blood panel to see how much, if any, we need to replace. So testosterone and estrogen work in synergy with all of your body's hormones, and both are involved in libido. For example, the bodybuilders shunt all of their hormonal production to testosterone to get every incremental improvement in muscle capacity. So they struggle with libido or wanting sex or thinking about sex because they don't have any estrogen. When they replace that estrogen in physiologically appropriate male amounts, they feel much better. For women, testosterone is also involved in a lot of the motivational pathways, such as mood, stamina, making sure that you don't need a 3 p.m. coffee or a nap, but it's classically studied in women for libido. A lot of my patients say that they love their partner. He's the love of their life, the father to their children, and their dream guy. They're attracted to their partner, but they just don't think about sex. They'd rather sleep. It's not top of mind. A lot of women don't seek care for symptoms of hormone imbalances because they think, I'm just stressed. It can be both and. You can be getting older, you can have a lot on your plate, you can be tired, you can be a mom, you can have a million things to do. But if you don't have the hormone balance that you had before, you're not going to have the emotional bandwidth and resilience that you once had to deal with the difficulties of life. Oftentimes, symptoms of low testosterone in women are missed because we don't think of testosterone as a female hormone. Symptoms such as a reduced sense of vitality, brain fog, low libido, poor sleep, low mood, low energy, night sweats can all be indicators of low testosterone that can be easily corrected. The first thing I always say when a woman is considering testosterone replacement is that this is not a do-it-yourself project. Do not treat with over-the-counter supplements or unregulated formulations of dihydrotestosterone, DHEA, or testosterone. Testosterone levels in women have a very narrow therapeutic window, which means it's very easy to give too much and to create side effects. Common side effects with testosterone replacement therapy can include acne, facial hair, and hair loss on the head. These symptoms do tend to be reversible and indicate that you need a lower dose. Irreversible symptoms that can be serious would be voice deepening and clitoral enlargement, as well as irritability. So these would be symptoms that you never want to have and can sometimes be irreversible, which is why it's so important to go to somebody who will be a partner in your care, who will check lab values and give you exactly the right amount, but not too much. My goal with hormone replacement therapy, especially with testosterone, is to give enough that your symptoms disappear. So if this is the floor beneath which you're having symptoms, my goal is to slowly steer the ship in the right direction so that we barely supersede that floor. The most important thing is not to wait until the wheels have come off. If you're noticing a shift from your baseline or a reduction in your vitality, come get a hormone panel at Ageless Expressions. We'll check a comprehensive panel of lab work that will include your hormones, but everything else that could make you feel off that's not a hormone. So it's always a good idea, even before you feel completely ready, to get a baseline for your hormonal health.